We appreciate you all being here, and we are here for a special event today. As we are going to have a nice presentation here, I'm going to introduce to you Gordon Dobie from Winston and Strawn, and he's going to present this award for this afternoon. Please.
Good afternoon. I'm Gordon Dobie from Winston Strawn, and I'm so happy to be here today and have the opportunity to present this award. I've learned recently about the important work of the Fetal Research Foundation, and I mean it's a really a phenomenal organization, and we're here today to present the award to Dr. Michael Ferrani, and this is just a. Let me back up and talk a little bit about the Fetal Research Foundation. The Fetal Research Foundation is a international nonprofit organization which gives awards for outstanding research to improve fetal conditions and safe fetal life. And the members of the board, Dr. Petrosky, of course, is one of them. They nominate candidates from across the country, look at literally hundreds of papers, and make a nomination and ultimately a vote. And here, the awards are usually given to large academic institutions and the like for research. This year, the award is to a large community-based practice that performs more than 1,500 deliveries a year, accepts all insurance, as many of you know. And in fact, Dr. Ferrani undertook an initiation of a vigorous system of fetal surveillance and allowing to substantially decrease fetal mortality. And prepared a paper, I think many of you have seen these, that was reviewed along with more than 100 other papers by the Fetal Research Foundation, and ultimately the preparation of the paper, the work of Dr. Ferrani's practice and so on, has resulted in the selection after a nomination and a full review by the entire board. So the paper by Dr. Ferrani was published at the International Conference in Rome and published in the Journal of Neonatal Intensive Care. And so we'd like to congratulate Dr. Michael Ferrani and associates for this award here today.
More.
Thank you.
Just want to say a word. I'm very excited to get this award. Thank you very much. Excellent. And this is thanks to the hard work of everybody in our organization, especially doctors and clinical staff, nurse practitioners and PAs and nurses and sonographers. Thanks to the hard work of everybody. We couldn't have done it without everybody's help. A few words. Is that your goal?
Well, I was not really prepared to speak today, but first of all, I definitely want to welcome Gordon Dobie, really an outstanding lawyer, and his wife, Marina Dobie. It's really a pleasure. They're old friends, and it's really a pleasure to see them there and to welcome them, to spend time with them. Now, what's really interesting about this paper, and I wouldn't hide, I nominated it, but other people nominated many other papers. And as Gordon mentioned, it usually goes for major academic centers. For example, Fetal Research Foundation awarded years ago a group of perinatologists who actually initiated laser division of twins, as you know, in twin-to-twin transfusion. Another award was actually given for fetal endoscopy in labor, which is relatively new procedure. When you put endoscope inside the uterus during labor to detect the status of the scar after previous C-sections. So it's more sort of innovative and more research-oriented, a little extreme areas in our field. But I think in this particular paper, and that's what I mentioned in the letter to the board of Fetal Maternal Research Foundation, it's not even about the fetus. I think it's also about the patient's rights, because the government regulations, and especially in obstetrics and gynecology, became very rigid. For example, the rule that we cannot deliver or do induction prior to 39 weeks have been implemented, and all institutions had to accept it. And I think it's reasonable in many cases, but clearly the price that we pay for them is stillbirth. Because between 38 or 37 weeks until full term, if we're gonna be strict on that rule, we're definitely gonna lose certain amount of fetuses, because that's the time when we know in obstetrical community, fetal environment very often becoming hostile. Many women develop, or some, oligohydramnios, etc., etc. And at least we have to inform the patient on such a case. And I myself had a pretty dramatic case, in my opinion, when the patient came all the way from Eastern Europe after IVF pregnancy, many years of infertility, wanted an elective C-section, and Mount Sinai will not allow to do it until 39 weeks on the dot. Sure enough, the baby died at 38 weeks and 5 days, 2 days before planned C-section. Listen, one case doesn't make science or statistics, and I'm not blaming anybody for that. And she's not even suing, not the doctor, not the hospital, she just left. But the whole idea is that at least we need to inform the patient, and let the patient right, that you cannot compare stillbirth versus some degree of morbidity as a result of delivery at 38 plus weeks, etc. At least the patient needs to be informed. So I think the group took a different approach. Clearly, you cannot fight the establishment, although we can vote against it, and we succeed sometimes. But the whole idea is that they suggested frequent fetal testing if we decide to deliver the babies at a later date. And as a result, they've proven, and that was published in this paper, and I think Dr. Tirani presented the paper at the conference in Rome, which is an international meeting of OBGYN ultrasound, saying that if you increase fetal surveillance, do it more often, you can clearly save some babies, because you will pick up oligohydramnios, you will pick up some patients with fetal distress, etc., etc. So I think that's a very important contribution, and I was very pleased that Fetal Research Foundation agreed with them, and this year the award was awarded to this particular group. So clearly, I mean, I was not part of the research, and that's part of the requirements. If you nominate a paper, you should not be either an author of the paper or someone who took part in the research, but I was very pleased that they agreed with my nomination, and my congratulations goes to Dr. Tirani, his co-authors, and the entire group, because it's really a practice effort. And so I'm really pleased to be here. So please enjoy the lunch, and thank you very much.
That's ingenuity.